Let's have a quick look at the spine. It's quite a key part of our body, and increasingly the way you exercise and live your life will help to maintain spine health. So we should be able to do at the end of this, you should be able to describe optimum postural alignment and describe postural deviations. So here's our spine, and you can see you've got 5 sections. So I'll just go through them quickly. They're called the cervical, the thoracic, the lumbar, the sacrum or the sacral portion, or the coccyx or the coccygeal portion. Okay, so we've got cervical, thoracic, lumbar, sacrum, coccyx. So as you can see, the cervical vertebrae of your neck, you can see they're generally quite small because they've only got the head to hold up. They're relatively mobile to other parts of the spine. The thoracic vertebra, and you can see these here. Let me just point these out. So that is where your ribs attach. So each of your thoracic vertebrae have a rib, and they come round to form your thoracic cavity. Your heart and lungs live in there. Then you've got your lumbar spine and your lower back. You can see we've now got big fat vertebral bodies to support the weight. Your sacral, although you've got 5 vertebrae, they're all fused together into one block. And in the coccygeal area, again, you've got 4 vertebrae, but they are fused into one block. So you've got 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal vertebrae. And if you notice, the spine kind of forms an S shape, and this is a much stronger form than being in a straight line because it can act like a spring if it has a lot of forces act on it. So you've got 2 concave and 2 convex portions. Okay, so there's your 2 concave portions, 2 convex portions. We'll go a little bit more into the curves in a minute, but those are the areas of the spine, and you can see generally your cervical vertebra should curve in this direction, your thoracic vertebra should curve slightly in that direction, your lumbar vertebra should come in this direction, and your sacral and coccygeal vertebra should come in this direction. But the deviations should be quite small. And what we'll see in a minute is some different types of posture where certain parts of the spine have got excessive or not sufficient curvature. Before you move on, just make sure you've remembered those. So remember the areas of the spine, remember the numbers for each, 7, 12, 5, 5, 4. So in terms of movement, the top 2 vertebrae, if you remember from our joint lecture, were the atlas and the axis, and they form a synovial joint, or a synovial pivot joint, which allows the head to turn from side to side, like you're shaking your head. The rest of it, there are cartilaginous joints in between the vertebral bodies, and there are synovial gliding joints in between these parts of the back of the spine. We won't go too much into that now. So the cervical, the thoracic, and the lumbar regions all allow flexion and extension, so coming forwards and backwards. They all allow lateral flexion, which is going over to the side and back again, and they all allow some rotation. Some parts are better at some of those than others, but we don't need to worry about that at the moment. But you can say they all allow you to bend forwards and backwards, to rotate, and to bend to the side. In terms of function, they perform a very important part in protecting the spinal cord. The spinal cord runs down, if you can see these spaces in there, which allows it to move around the body, but also protects it. It's very difficult to damage. And the cartilaginous joints serve as a bit of a shock absorber when you're landing. Okay. So you can do this on your own. Just move your spine around in different directions. Try going forwards and backwards. Try going side to side. And try twisting. And you should feel the spine, the different areas of the spine moving. Let's have a quick look at optimal posture and then some unoptimal ones that you will see. So if you've got someone lined up in an optimal position, you should find that these points in the body line up. So it should go the earlobe, the axis of the shoulder, The greater trochanter, which is the little bony bit you can feel on the side of your hip, should go just in front of your knee and then just in front of your ankle. And you should find all those points line up in a nice straight line. This puts your spine in a position where it can move, it can twist, it can bend sideways, and your body can work very, very optimally. And that means it's less likely to get injured, and generally tends to look better if you have an aesthetic goal. We do get some positions where things come out of line. So here we've got what's called a hyperlordosis. So compared to our optimal position, our spine here, our lumbar spine, has become excessively extended. All right, so that's causing an excessive extension in the spine, and that's tilt the pelvis forwards. And this part of the pelvis is lower than this part. And you tend to find there's certain muscles around this which are tighter. So there's a muscle that goes down here, your Iliopsoas. This tends to be tight, and the back muscles here tend to be tight, the erector spinae. Whereas things like your hamstring, which comes off this hip portion here, can be lengthened, as well as your rectus abdominis. So look at that one, you'll see that quite a lot. Another common one is a hyperkyphosis. So this is where you've got an excessive flexion of the thoracic spine. Okay, so you'll see that a lot of people who sit at a desk a lot or work out very heavily, mostly their chest. So you tend to see that you might have a head poking forward and a curvature of the spine here. Often they've got tighter pectoral muscles or front muscles than the muscles at the back, which are meant to retract the shoulder. So it's generally what happens. So generally the chest is tighter than the rhomboids and the mid-trapezius, and that causes you to pull into this position. So a good thing for these people to do would be rows, wide rows, or lat pull downs where you squeeze your shoulder blade together. Scoliosis is where you see a sideways curvature. This is often born. Sometimes it can be created by tight muscles. And there you see some common deviations, and should be able to relate them to optimal posture. Practice doing that, see who you can see, and see if you can recognize any postural deviations in them. Check out the Kahoots, test yourself, and notice your own posture and that of others, and relate to them to exercises.